Good morning, everyone. My name is Felicity, and I'm here today to talk a bit about closing the gap as a health outcome for Aboriginal and Torres Strait Islander individuals. There are four main key points that I'm going to be covering today. Firstly, I'm going to talk a bit about health disadvantages, and I'll be comparing it from Aboriginal and Torres Strait Islander people to non-Aboriginal and Torres Strait Islander people, and provide some statistical evidence to support it. Secondly, I will be giving a backstory on the Close the Gap campaign and explain how this is experienced in hospitals around Australia. Next, I'll describe how a nurse or a midwife can help Aboriginal and Torres Strait Islander people reach the health outcomes that we need in order to live a sustainable life in alignment with non-Indigenous people. Lastly, I will focus on strategies we as midwives and nurses can use in order to help boost the rates of antenatal visits, which helps decrease preterm birth rates. Firstly, I would like to just make an acknowledgement of country. I would like to firstly pay my respects to the traditional owners of the land in which this presentation takes place today, and extend my respects to any and all Aboriginal and Torres Strait Islander people here today. Thank you. Imagine a country where people have the same access, the same care, and the same health outcomes as each other. Health is a relatively huge word that has a lot of other sub-meanings that are still as important for someone's well-being. Describing someone's health, most people would think sick or healthy. Health for Aboriginal and Torres Strait Islander people is objective. It's involving physical, emotional, cultural, spiritual, and environmental well-being for both families and communities. Many Indigenous Australians experience poorer health than other Australians, often dying at much younger ages as a result of health disadvantages. This is where the disadvantage comes into play. With a gap in our health system, life expectancy issues were raised a concern to medical professionals when they noticed gaps in the ages people die between both Indigenous people and non-Indigenous Australians. Disadvantages to an individual's health impacts their mental health as well. As the sub-meanings mentioned previously, mental health is held accountable for 10% of the health gap between Aboriginal and Torres Strait Islander people and non-Indigenous people. As a community and as a whole race, it is unfairly propositioned that life expectancy isn't associated as such an important issue. Life expectancy is a broad goal that is influenced not only by health, but also by sociological factors such as education, employment, housing, income. In the years 2015 to 2017, Indigenous men had a life expectancy of 71.6 years, while Indigenous women had a life expectancy of 75.6 years. If we compare it to non-Indigenous men and women, life expectancy at birth was 80.2 years for men and 83.4 years for women. The Close the Gap campaign has a target to increase the life expectancy of an Indigenous individual by closing the gap to achieve gaining an additional 8.6 years for men and 7.8 years for women. What is closing the gap? Australian governments agreed in March 2008 to work together to accomplish life and health duration that is equal between Aboriginal and Torres Strait Islander peoples and non-Indigenous Australians by the year 2030. The Closing the Gap scheme was adopted by the Council of Australian Governments, COAG, which specified 6 performance targets in the areas of health, education, and employment to ensure development. The strategy acknowledged that the closing the Indigenous disadvantage gap will indeed take an extended generational dedication with development and discovery on a number of priority issues, including early childhood, education, health, economic participation, healthy homes, safe communities, and leadership and governance. There are 17 targets that need to be achieved by 2030. Some are already met and some need more effort and support. The 17 targets are as followed. As you can see on my presentation, I've narrowed it down to a few words. Didn't want it to all fit on it. So the 17 targets are that people live long and happy lives. Babies are born fit and healthy. In their early years, children obtain high quality, culturally safe early childhood education. Kids flourish in their early years. Children to achieve their non-limited learning outcomes. Students reach their full learning outcomes through higher educational pathways. Youth are involved in employment or education. Individuals and their communities benefit from strong economic engagement and growth. People can find suitable, low-cost housing that meets their needs and requirements. Throughout the criminal justice system, adults are not overrepresented. Young people aren't overrepresented in the criminal justice system. Children aren't overrepresented in the child protection system. Families are safe. People are in good social and emotional health. People have special affinity with their land and waters in terms of culture, spirituality, physicality, and economics. Physicality and economics. Cultures and languages are powerful, well supported, and vibrant, and people have access to information and services that allow them to make well-informed decisions about their own life. In hospital systems, the Close the Gap targets are barricaded from reaching their goal, as treatment for Indigenous people are not the same as the care given to non-Indigenous people. A journal article states, Indigenous people in Australia have to tolerate extended wait times, different pain management, and less evaluation from nurses and doctors, and less treatment for minimal conditions within emergency care. So, the reproductive health results for Aboriginal and Torres Strait Islander mothers and infants are much lower than non-Indigenous Australians, and they become worse as distance gradually expands, making service delivery more complex. Outer regional and rural areas are home to 55% of Aboriginal and Torres Strait Islander birthing mothers, who have among the lowest health outcomes in the country. Not all of these women are receiving antenatal, birthing, or postnatal care from a registered professional. Strategies are in place for midwives to help close the gap in antenatal care. Strategies in place for midwives to help close the gap in antenatal care would be through the deployment of caseload midwives and midwifery group practices all around the country. Patient care should be restructured to correspond to action and patient needs. Birthing on country is a beautiful way of supporting an Indigenous mother and her baby as a midwife and medical professional. Birthing on country is frequently thought to be significant to Aboriginal women living in rural and remote areas and is rarely connected with metropolitan environments. Bringing an option of birthing your child on country for Indigenous women will boost rates of antenatal care visits, which in the end will help reach the target of babies are born fit and healthy for the Close the Gap campaign. Whilst working in an antenatal clinic, it's important for patients to trust you in order for freely honest answers. Building a relationship with the woman is a key focus in building trust. Seeing a woman throughout her whole pregnancy is another great way to ensure targets are reached, as it guides the mother into continuity of care as a caseload midwife. My first strategy to implement is to enforce caseload midwifery and midwifery group practice into the antenatal clinic, as it's been proven to help strengthen antenatal care for Indigenous women. A study shows that between 2017 and 2020, a study was successfully implemented in 3 large urban maternal health services. At the 3 locations altogether, 5.8% of Indigenous women never experienced caseload midwifery. 90% of the 844 women who were offered the approach accepted it, and 89% already received it. Whilst a total of 40 women were assigned to standard caseload midwifery. Much more than half of the women interviewed gladly accepted caseload as a standard care. Another strategy to try and get into action of starting up is building and creating birthing rooms for Indigenous women inside hospitals. A study was made in regard to this, and the results and data were incredible. Results were that it reduced family separation at critical periods. It strengthened community empowerment. Family connections enhanced. Domestic violence decreased. Increased collaboration and engagement with other healthcare professionals and service providers. It provided them with treatment that is extensive, collaborative, and personalized. Evidence proves that maternal and infant health outcomes have also improved as a result of this study. So in conclusion, to sum it all up, Aboriginal and Torres Strait Islander people are disadvantaged in all aspects of health: early death years, non-extensive emergency care, and disadvantaged access to antenatal care. Closing the Gap recognises the extent in which Indigenous people are lacking within healthcare. Measures are in place to ensure that these gaps are met by the year 2030. Thank you.